Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living Tuesday, everybody. Your pituitary glands are organs within your body that perform very specific and very, very interesting functions. You may be interested in this next segment. And to discuss those with us, our good friend Dr. Jitka Lom from Express Care. Doctor, welcome back.
Hi, Jason.
Okay, pituitary glands, what are they? And maybe in the grander scope of things, how does the pituitary system maybe differ from other systems like, endocrine or adrenal?
Okay, well, the pituitary gland is just one, actually. It's a pea-sized little gland that sits right behind your nose here, between your eyeballs, and it produces 8 different hormones in your body that are sort of like the central control for what happens in the rest of your body. So some of the hormones that it would produce are the hormones that control your thyroid gland, your adrenal glands, your growth hormone, determining how tall you get as a child, even hormones that produce that help you produce breast milk if you're breastfeeding after having a baby. So it has, and also it produces hormones that control the ovaries and the testes. So basically it controls much of your body, this tiny little nerve center in the middle of your brain.
And that's probably why it's located where exactly it is. It's shielded from,
it's shielded.
Damage by the skull, which is very, very well pretty
protected.
Good fortress.
Yeah.
Okay, so would you say that the pituitary system is maybe, is it key as opposed to some of the other systems like you mentioned, like adrenal and endocrine, or do they all kind of work in concert?
It's actually the top in the endocrine system. Okay. Yeah, it's there's one level a little bit higher. That's your hypothalamus. That's the actual brain. But then the brain controls the pituitary gland. The pituitary gland controls everything else that happens in your body.
Oh, okay. And this is one of those things that you doctors, or the leg bone's connected to the ankle bone, but you do it at the system level.
Yeah, at the system level. Anyway, the pituitary is a very fascinating organ because it does control so many different things, and it's so very powerful. If there's a tumor in the pituitary gland, or if there's a deficiency there, it can affect many different things, from things like infertility to things like short stature, to problems with growth, to problems with your thyroid gland, to blood pressure problems. So many different things can be affected by that.
Now, when things go wrong with it, as we always talk about here on Healthy Living Tuesday, is it lifestyle that kind of determines maybe like a breakdown or how it's affected, and it's one of those things that you really have to, maintain, or is this, it's just subject to weird mutations over time?
Right, it's just usually actually a random thing where the pituitary gland can actually be subject to a stroke, or again a tumor, or sometimes after childbirth women may lose a lot of blood. After that, their pituitary gland may actually be deficient because of all that trauma that is experienced with not enough blood going there. So there are a whole bunch of different reasons, but they're usually not at all related to lifestyle. Like you said, the pituitary is really shielded in there, so the only things that really affect it are either tumors or lack of blood.
So what can I do as a person who's admittedly paranoid, and like the last time you and I sat here, we were talking about the appendix, and basically like there's nothing I can do to keep it from getting, most things I can keep, to keep it healthy and make sure that I don't have to have an appendectomy, but what can I do to make sure my pituitary gland is performing at tip-top shape?
Actually, nothing at all. It's really not anything that you could control.
That's good and bad.
It controls you.
Well, you're scaring me now, Doc. Okay, well, is there anything that physicians like yourself look for, like if somebody comes in and they're like, I've been feeling not so much myself lately, or I've...
How do you know there's something wrong?
Yeah.
Well, oftentimes if there is a tumor in the pituitary gland, people will have headaches again right around here, and sometimes if it's very severe, it's a very large tumor, they'll actually experience double vision because it'll be splitting the nerves that control your vision. And so double vision and headache would be an extreme symptom, but other times people might just have very vague symptoms like fatigue, weight gain, again, problems with their fertility or with their menstrual periods. Those are some things that might point us to, there might be a pituitary gland problem.
Oh, double vision. So that's a really scary thing, but it's a good foreigner song. Okay, so there's basically nothing we can do to make sure it's just one of those random things. Is this something I should read up on, as far as like me? Because again, I'm
trying to.
I'm a hypochondriac. I want to make sure that everything you're telling me, I want everything to be firing at optimal capacity.
No, I don't think you need to worry too much about it. It's just, as a point of interest, it's very amazing that this very tiny little gland is operating without you worrying about it at all. It's doing its thing and keeping you very healthy. And even more amazing than that is the pineal gland, and that one's a teeny tiny rice-size gland in your brain. It's sort of opposite your pituitary is here, and the pineal is sort of a little further back towards the other side. And that one is kind of sometimes known as the third eye, because that one controls light and dark. Well, actually, it responds to light and dark, and so it will produce a hormone called melatonin and help you go to sleep at nighttime. So that's another very interesting thing that you have in your brain you probably didn't know about.
No, definitely, I did not. Well, okay. Well, before we go to commercial, and we've got our Facebook questions on the flip side of this break. But is the pituitary function something that like most other human systems and everything, slows down with the process of age?
It does. In fact, it's very interesting with growth hormone. The pituitary gland will produce less and less of that over time. And actually, if you look at people as they age, their growth hormone goes lower and lower and lower over time until it's at zero, at which point they do die. So you can monitor that. And so sometimes now people are trying to supplement with growth hormone, human growth hormone. You've probably heard about it on the internet, taking shots to try to stay young. And that's a way of supplementing what the pituitary gland is already doing on its own.
Okay, well, we will be right back. Dr. Lom, we have a lot of really good questions about the pituitary gland. People on Facebook really interested about this topic, so please sit tight, and you sit tight there out in TV land, because the good doctor will join us. We are talking about all things pituitary when we continue right after this.